Pleasant good night, and thank you for joining HealthWise by the St. Kitts Nevis Medical and Dental Association. As usual, it's a pleasure spending my Monday night with you. I am your host, Dr. Woodley-Fassale. Tonight, we are going to be continuing a discussion that we started last year in November, which is postpartum depression, and specifically the mental health issues that affect ladies after giving birth. Tonight in studio, I have with me to mince this topic, delve deeper into this topic, Dr. Kerise Manchester, gynecologist, obstetrician, and Dr. Cheryln Ward-Crawford, clinical psychologist. We are going to take a short break. So as you know, this is the time to text your friend, let them know Dr. Woodley and HealthWise is on, and we will be right back.
Best Way Pharmacy, conveniently located in the Caribbean Cinemas building. We provide easy parking, a private consultation room, and service with a smile. We open Mondays to Saturdays, 10 a.m. to 9 p.m. Call us on 466-4480.
Okay, welcome back to HealthWise. I am Dr. Woodley, and tonight we are going to be discussing postpartum depression. If you don't think about it, if we don't talk it, then we will never diagnose it. And then we would have unfortunate outcomes, which we as a public and a federation experienced a few weeks ago, where an unfortunate event shocked and shook us terribly when two victims were taken presumably because of mental disease in the postpartum period. Tonight I have with me Dr. Manchester, who is a gynecologist, obstetrician, and who deals with ladies who are pregnant. And I also have with me Dr. Cheryln Ward-Crawford, clinical psychologist, who should or normally in her work gives psychological support to patients and ladies after giving birth. Dr. Manchester, welcome, and give a short introduction of yourself before we actually get into the discussion.
Thanks, Dr. Woodley. I am, as mentioned, Dr. Kerise Manchester. I'm an obstetrician-gynecologist. I practice at the Joseph and France General Hospital and at my private practice in the Sands Complex, Manchester Medical. And I see pregnant patients, and I see them postpartum, which is after delivery. So this condition, postpartum depression, I would come into contact with ladies at risk for this condition from start to finish in terms of pregnancy, childbirth, postpartum.
Okay, so Dr. Manchester, and before we get Dr. Crawford in, how does postpartum depression, how can you identify any red flags when you're seeing someone who is pregnant with this condition? Any red flags, any risk factors, anything you can see?
Absolutely. So there's varying risk factors for postpartum mood disorders, because it's not just depression, right, as doctor will probably get into, Dr. Crawford. But the mood disorders in general, there are many risk factors, and you can classify them in terms of biological risk factors and psychosocial risk factors. The biological risk factors are ones that we can't quite change per se, but there are some of those, and obviously a previous history of being depressed, having a depression or a mood disorder can put you at risk of postpartum depression and mood disorders. If you have a family history of mood disorders or mental illness in general. If during your pregnancy you had a depression episode, then postpartum you would be at risk for it as well. In a previous pregnancy, if you've had postpartum depression, then in the next one you're at risk for it as well. Bipolar disorder specifically is a very big risk factor for postpartum mood disorders. Now, the ones that I really want us to pay attention to as not just clinicians, but as people who have relatives and friends and colleagues, what have you, that may be at risk for postpartum depression are the psychosocial factors, right? Because this is really where we can make a difference in terms of seeing the red flags. So, age. Age is one of them. That's not really something we could change either, but it is a factor. Very older women in pregnancy, over 40, and the adolescents. And the adolescent group is really the one that we can change, because there are things we can do as healthcare providers and as a health institution and ministry, etc., to take that group out of the equation totally, right? To try to control that. Education level. Postpartum mood disorders tend to happen and correlate with women with a lower educational level. And pregnancy intendedness. So was the pregnancy planned? Was it unplanned? Most pregnancies are unplanned, but particularly in patients who have lower educational level, inadequate social support, socioeconomic or financial difficulties. These patients tend to have the most risk for mood disorders postpartum and even in the pregnancy, in the antenatal period as well. Patients who have recent negative life events, some traumatic event, a loss of a family member, death in the family, loss of a job, loss of employment, cultural expectations, right? Some of these signs and symptoms of mood disorders in the postpartum period, we kind of expect mothers to have them in a sense. And we also expect mothers to do everything, right? And we don't quite expect them to need the social support that they actually do need. And difficulty with breastfeeding can also be a factor, because, I mean, I don't know, but breastfeeding for me is one of the hardest things I ever do in my life. I have to say. I know some women make it look easy, but it can be very difficult. And then it adds to the whole, difficulty of child rearing, and needing that support is important.
So, Dr. Manchester, we're going to stick up in there, because I want Dr. Crawford to come in. And Dr. Crawford, you need no introduction, because we know you. You've been here. You're a staple at ZIZ, so we don't have to introduce you. So, Dr. Crawford, so Dr. Manchester has just spoken about the risk factors. So, the risk factors are the persons who are likely to develop postpartum depression after giving birth. But what is postpartum depression? How does that look?
Okay, so postpartum depression is a depression that occurs within the postpartum period.
So you have to look sad in order, because I see people depressed but look happy. Because what we are trying to do here is that when this show is over, we want people to be able to identify that something is wrong. You may not be able to treat it, identify it's wrong, and go and get help. That is the objective of this show.
Okay. So we can have persons presenting with mild, moderate, or severe, presentation. But let's look at the symptoms. As I said before, it can happen between the postpartum period, and that is after birth up to a year or so, you can have postpartum depression. What we look for firstly is sadness. We look for two things first. If the person is presenting with sadness, and it's persistent sadness, and when we say persistent sadness, we're talking about sadness that lasts for majority of the day, for majority of the days of the week. That is what we're looking for. And then we are also looking for lack of motivation. And it's the lack of motivation in doing things that they are accustomed to do, and they used to find some sort of pleasure of doing. So they're daily activities, and in this case, caring for the baby, caring for the home, etc. Lack of motivation in those things. If the person presents with either one of those first two symptoms, then we look for some additional symptoms that would help us to determine if the person is suffering with postpartum depression. So we look for some symptoms related to sleep, and it could be extreme. The person might be sleeping too much or not sleeping at all, Or we look for symptoms associated with appetite, and extreme also. The person can be eating too much or not eating at all. We look for symptoms related to concentration. It might be lack of concentration, and also this indecisiveness. They can't make decisions, okay? We would have persons experiencing what we call fatigue and low in energy and tired all the time. These are symptoms we are looking for. We're looking for symptoms related to hopelessness or helplessness or worthlessness, these types of feelings that they would get. And of course, it can be so severe that the person can present with recurrent thoughts of death, where, what would it be if I died? I wonder if I died, what would happen? How would I feel? Or they would have suicidal ideations, meaning now they are thinking that they want to kill themselves. And they could have it with a plan or without a plan. So these are the symptoms we are looking at. And we will want to know, is it mild, is it moderate, or severe?
Okay, that was quite a mouthful. But before we break, because we have, our show has been revamped, and we have upgraded it, and we have some word from the street, and we also have persons participating in pre-recorded sessions. But before you get there, and before we go there, Dr. Crawford, what about the baby blues? Because I know after birth, the hormonal change, you have this tiny being you have to take care of. It is overwhelming. What was overwhelming for me was hanging out the little socks. And, that was driving me crazy. Because it's one little sock, one little disc, and I couldn't deal with it. But then my mother-in-law, who I was with at the time, I think she saw it and she moved in. She said, you know what?
She'll take care of it.
I'll take care of it.
That's good.
So is that, was
so
I...
important the support was.
Yeah, it was very important. Yeah. So was I in a postpartum depression or just the baby blues? I was fatter.
Okay, so my feet let's differentiate. Yes. Let's differentiate. Okay, so we have what we call the postpartum blues or the baby blues, as you may call them. And yes, it could present with some sadness can be there, some level of sadness can be there, some irritability can be there, some tearfulness can be there. But how does this differentiate from postpartum depression is that you are not going to find symptoms of hopelessness, worthlessness, and helplessness, and you're not going to find symptoms of recurrent thoughts of death and suicidal thoughts with or without a plan. Because if it goes into those kind of symptoms, we are crossing over into postpartum depression. Great. We still have to think about postpartum psychosis also, which is at a different level too, that we need to differentiate. And that is when the person would have lost contact with reality.
Okay, so that's great. So we're going to listen to our first off the street, Miss Deming, Nadia Deming, with her experience suffering going through postpartum depression.
I knew something was wrong. I wasn't my usual self, and my usual self, I take pride in my physical appearance, where I dress nice, I like makeup, I like getting my hair done. And after I had my son, this wasn't happening. It would be days where I would not shower, I would not comb my hair, I was very depressed, and I thought that I didn't get the sense of joy that I saw everyone, persons who had a baby would have when they have a baby. So I knew something was certainly wrong. I would cry excessively, I would eat excessively, I would think twice when it comes to my care in terms of how I took care of myself. Of course, I put the baby first, but I was not in the mind that I knew Nadia to be. Overcoming postpartum depression was not something easy for me. I hesitated a lot because I believed that this was my new norm. This is my new life. My life would be sad taking care of this whole other human. And so it was a slow startup in getting over postpartum depression. But I had friends in my corner. Support is vital. I had friends in my corner that encouraged me first to join a small women group where there were different women there who struggled with different aspects of their lives. I think I was the only one there with the postpartum depression, but that was a start. And then I committed myself to a constant counseling with 3 C's. Andrea, I affectionately call her Angie. She is great when it comes to postpartum depression, and that is where I start to overcome or start to show some sort of progress when it comes to postpartum depression, along with the baby getting older, and so things get a little easier and understanding, getting a better feel of motherhood thanks to the counseling, and that is how I overcome postpartum depression.
It's time that we realize that we must work together to thrive. As we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see, and the climate's changing,
but hope is remaining.
And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are. One climate, one Caribbean. One climate, one Caribbean.
Yeah, man. Another day in the books. Well, hello there. Ooh, she pretty from head to toe, and are you ready to go? Wait there. Whew. Can't afford to slip up. Not even in my dreams.
Good night, and if you're just joining us, we are speaking about postpartum depression part 2, because we started this discussion last year because we saw it was very important. We have in studio with us Dr. Kerise Manchester and Dr. Cheryln Ward-Crawford. I want to thank Miss Deming Nadia for sharing her experience with us, and she did so eloquently. And if we don't speak about postpartum depression, we will never diagnose it. And as I said before, if we don't diagnose it, we are going to end up in unfortunate situations. So Ms. Deming, kudos to you. I also want to thank your friends, your support for coming out and helping you pull through postpartum depression. It is not easy, but what we are here tonight to say is that you are not alone. There's nothing to be ashamed of, and many persons actually suffer from postpartum depression. So Dr. Crawford, just before we broke to hear Ms. Deming, we were speaking about the baby blues, which I think I probably had some of that. Mm-hmm. Then Dr. Manchester already spoke about the risk factors for postpartum depression. But there is another step, which sometimes we don't like to speak about, which is postpartum psychosis.
Okay.
Can you give us, let us try to understand, make sense of this.
Okay.
Very good. And postpartum psychosis is less rare compared to postpartum depression, but it is real. So what is postpartum psychosis? It's a disruption in the person's sense of reality. And how does that happen? The person may present with what we call hallucinations and delusions, etc. Now, what do we say are hallucinations? Hallucinations are when the brain is picking up activity, the brain is picking up input that does not really exist. So what happens, it has to do with our 5 senses. So in this case, the person might be hearing things that only they alone can hear. They might be seeing things that only they alone can see. Now, postpartum psychosis, it is a health emergency, because can you imagine somebody is hearing things that only they alone can see, and seeing things only they alone can see, and it is real to them, but that reality is not real. Okay, so you might have persons also presenting with what we call delusions, and these are fixed false beliefs. And there are different types of delusions, but one I want to highlight is the delusions that are of what we call them, delusions that are related to having thoughts that they, for example, they're not pregnant. Okay, they may have thoughts they were never pregnant, they never got a baby or anything like that. Okay, so those are delusions of somatic nature, where the mother is thinking they don't have a baby, they never were pregnant, and would insist on that, and that is the fixed false belief that they are having. With postpartum depression, the postpartum psychosis, there's a heightened risk for suicide and homicide. So in this case, the person's at more risk of committing suicide and harming the baby, committing homicide. Now, there are other symptoms associated with the postpartum psychosis that you may see, and this might be disorganized thoughts, in that the person's, or disorganized speech, in that the person might be speaking and you just don't understand what they are saying because it doesn't make sense. Or we may realize that they just have disorganized behavior, in that they're just doing things that just not add up, just look off.
So Dr. Crawford, let me ask a question. Can a mother harm a child during baby blues, during postpartum depression, and during postpartum psychosis?
Well, with baby blues, okay? Baby blues only lasts for a few days. Okay. And one of the things that help us to differentiate it quickly is that, you know, instead of increasing severity, we start to see decrease in severity, and they resolve on their own. Now, when we have postpartum depression, yes, we can have persons committing suicide or even harming the baby with postpartum depression. And when we have postpartum psychosis, even more so.
Okay, so we're going to take a short break, and we're going to listen to another survivor. And folks, this is real. It happens to people. And why this survivor I like, this survivor is a nurse.
My name is Nicole Frederick, and I became pregnant right out of high school and suffered with postpartum depression right after I had my son. It was not easy, but it's a process, and I got through the process with the help and the support of friends. There is no one thing that I can pinpoint and say that this is the one thing that helped me through my depression. What I can say though is that it's going to take some effort. It's going to take some effort physically, mentally, emotionally, and spiritually, of course. For me, what I did was I kept check on my emotions. I think that is one of the most important things that you can do. Keep check on your emotions. Identify your triggers, recognize them, whether it's an environment, whether it's a person, whether it's a thing. Make sure you identify those triggers. And sometimes there isn't even a thing or a person why it triggered you, it just happens. But identifying and recognizing them can help. Additionally, I went to college immediately, or almost immediately, like 3 months after having my son. And I think that served as a distraction for me in coping with my postpartum depression, you know, having the assignments and knowing that I did not want to fail, I wanted to pass, but I did not just want to pass, I wanted to excel and ensure that I created a brighter future for my son. And the last thing I think I did was replacing bad thoughts, bad emotions with good ones. So if at the time I was thinking that, you know, I am not pretty, I don't matter, my life don't matter, I had to make an effort, intentionally tell myself, hey, Nicole, you do matter, you are very gorgeous, and life matters. So those were some of the things that I did in helping to control or deal with my postpartum depression. If it wasn't for my dear friend, God bless her soul, I don't know where I'd be. If it wasn't for her calls, if it wasn't for her prayers, if it wasn't for her coming to check on me, just coming to see if I'm okay, if it wasn't for that, I really don't know where I would be, because it mattered. Having someone around you or having family members around you matters very much in how you cope with your postpartum depression. It made a big difference. Having her come around and tell me, you know, Nicole, it's okay to cry. It's okay to feel sad. It's okay to feel angry.
At Best Way Medical, we are dedicated to meeting all your medical needs. Our friendly staff is always available and ready to assist. Our trusted physician is also equipped with the knowledge and expertise to best serve you. Make Best Way Medical your medical center of choice.
What did you mean earlier about climate change, Mom?
Well, when I was your age, I remember beautiful coral reefs and healthy beaches. The summers weren't as hot as they are right now, and the rainy season meant that it only rained when it was supposed to.
And then what happened?
The weather just started to change, and storms got worse. Coral reefs started to die because the ocean was getting too warm, and crops started to die because there was not much rain. You know, we realized as adults that we were doing something that was causing this.
What were you all doing?
The same thing we're doing now. Not using clean, renewable energy, chopping down too many trees, and even polluting the air with gases, such as the gases emitted from our cars when we drive around.
We need to help before it's too late, Mom. We can't let it get worse. What can I do? We can raise our voices.
With 35 million dreams, aspirations, and futures at risk in CARIFORUM, we need your voice in our story against climate change. Acknowledge, commit, act. This message is brought to you by the Caribbean Community Climate Change Center under the Intra-ACP Global Climate Change Alliance Plus program and is funded by the European Union.
Welcome back to HealthWise by the St. Kitts Nevis Medical and Dental Association. We are here speaking about a very interesting topic, which is postpartum depression. It is real. And if you suffer from postpartum depression, you are not alone. What's the percentage? It's a very high percentage of ladies who suffer from postpartum depression. So it is something that is real. It is something that we have to speak about, because as we mentioned earlier, if we don't speak about it, we would never diagnose it. Dr. Crawford said something very important, that postpartum depression, postpartum psychosis, these are emergencies. Just like when I have a stab wound at the hospital, I have to go and treat it. When Dr. Manchester has an ectopic pregnancy, you have to go and treat it. You have to get out your house, go and get it treated. This is no different. It needs to be treated. It's an emergency. If you cannot get help from the conventional routes, there are always the hospital is there. Head to the accident and emergency room because it's an emergency. We also want to thank Nurse Frederick for sharing her story as well. And I know her story would help so many mothers out there. Having a child should be a time where it is joyous, but some mothers cannot access that joy because it is a period that is overwhelming. And it is normal. You have the support. And what our two survivors have highlighted was that social fabric, that social safety net. We have to be better friends. We have to know when our friends are going through something. We may not know the name, we may not know the diagnosis, but we must know that something is wrong. Nurse Frederick also highlighted prevention. And I'm going to ask Dr. Manchester to come in and speak to us about prevention of postpartum mood disorders. Dr. Manchester, what can you tell our young mothers out there who are suffering from this?
Well, one of the keys is identifying who is at risk. We spoke about some of the risk factors already. And so if you know that you have a friend, a family member who doesn't have the support, you know, they always say takes a village to raise a child. Some people don't have that village. Some people also can't afford to pay for that village either. And so if you know that there's someone recently or pregnant or recently had a baby, don't have the support, don't have the financial support, having a hard time breastfeeding, they have other children in the household to look after. These are all factors that's setting up for them to have a rough time. Adjustment and getting their bearings, because one of I think the first young lady spoke about that, right? That eventually it gets easier as she got her footing and stuff, but sometimes that takes quite a while, right? That may take quite a while if the support isn't there. So identifying those women who have those issues, then you're gonna know to check in on them. You're gonna know to maybe get them help if you see that something is wrong.
Are we checking in on each other, Dr. Manchester?
Probably not. And you know, even as health professionals, we may not be checking in either, because like I said, you know, I may have patients who come to me postpartum and I say, how are you doing? You know, I'm not sleeping. And part of me thinking, well, that's part of childbearing, right? You don't really get much sleep with a newborn, right? So those symptoms can actually be depressive symptoms, as Dr. Crawford said, the lack of sleep, the not eating, and the this and the that. We think that's a natural consequence of having a child.
So then it's up to us now to actually change our way of thinking.
Correct.
And that is why we're here, because life is always evolving. We don't learn everything in school.
Right.
And it's when we are actually practicing, we realize. So that is why I have Dr. Crawford very close to me. And whenever I see anything, I call her up. I say, you know what, I'm going to send this patient to you. And I think we have to learn to, you know, be more interdependent.
Correct. Yes.
Because that is how we save lives. And I really don't want this conversation to be so rigid and so structured, because postpartum is not like that anyway.
No,
it hits anybody. It doesn't matter the socioeconomic background of the person.
Correct.
I was looking at some the other day where I saw all of these big stars who went through this guy who sings out, his wife went through postpartum. John Legend, yes, his wife went through it.
She had a lot of difficult pregnancies. So that ties back to the risk factor. She had a lot of traumatic events throughout her pregnancy. So, you know.
So what else can we do as a community, a medical community?
So there are a few things I think we can change in terms of, you know, public health and looking at the issues in terms of postpartum mood disorders. For one, I think that we need to establish a postnatal clinic at our tertiary care center, which is JNF. We currently don't have one. And, you know, it just takes a little bit of change. It doesn't really take much funding necessarily, but just staffing, a little bit of change. We already have the clinic space, things like that.
So can you say it again so Dr. Morton could hear you?
Which camera?
Which camera? Look for the camera. Here. Yes.
We need to establish a postnatal clinic at the tertiary care center. I know they're in the public health clinics, but there needs to be one at the tertiary care center where we have the multiple disciplines, right? Where we have them there, we have the accident and emergency, etc. We need to work on establishing that. That's one. I'm not sure if the public health nurses do it already, but I think home visits would be important during the postpartum period.
They used to do it. I don't know how.
I'm not sure if they still do it, but that's a way to pick up things. That's a way to find the isolated mother who is at home with the 2 children who may be having an issue that nobody knows about. Home visits. I know there's breastfeeding support clinics at the public health clinics, but they're not available daily. I think that having them available daily would make a difference in patients who may be having a difficult time breastfeeding. This now doesn't quite take funding, but it's going to take a lot of change and adjustment. I think extending maternity leave to 6 months at least. And that's at least, because in some countries it's a year, it's 18 months. I think extending paid maternity leave to 6 months at least because of the same breastfeeding. I mean, we promote it so heavily for the whole 6 months, yet we're telling women go back to work at 3 months. That's just going to add to the difficulty. Right?
So I hope the policymakers are listening.
I hope so too.
Because we're here to just lay down the brakes. We're not here to point fingers and say who is wrong and who is right. We just want to change it.
Correct. And remember the young lady said, again, getting your bearings, getting time to adjust and nest with the newborn. Sometimes that take more than 3 months. So that's something we can consider, and it has other benefits too outside of just mood disorders, extending that paid maternity leave, 6 months. More family planning promotion, because remember, unintended pregnancies, risk factor again, allowing women this space to empower themselves financially, educationally, all those things before they embark on childbearing will help decrease some of these things. So more family planning outreach and promotion and education on that. Implementing this tool, I don't know if Doc can talk more on it, this Edinburgh postpartum depression screening tool. It's 10 questions, right? A 10 item questionnaire that's self-administered. It's scored by many different, not just doctors can score it, but the midwives, all the health professionals can score it. This right here. Making it mandatory when you come for your postnatal visit or even before you leave the ward with the baby. You make it mandatory that it is done by each patient. I don't know, I know for sure it's not done on the maternity ward. I don't know if they're doing it in the clinics. I don't know if, Doc, if you know if they do it in the clinics.
No. In the past, what we have used is the PHQ-9.
Oh, okay.
That
even that
is
one.
For depression.
Even that one. That's a different one.
Postpartum depression is just depression in the postpartum period. So either one can be used. But at the hospital, we would, when I was there, we used the PHQ-9. But
it's not mandatory for every postnatal patient.
Any referral we used to get from psychology,
but not the patient in-house do? Because sometimes a patient may not reach to your office.
Right.
So is there any tool that I can probably give like to a sister or to a husband and say, hey, and start ticking off?
This is the same kind of questionnaire.
Okay, so that's slide 13.
It's scored by a health professional.
Scored by a health professional.
Right? Okay. So they can fill it out and then it's, Yeah,
but I like to tell persons, because sometimes they might not have the paper at hand, they can't find, they don't remember the name, they can't even Google it, What we're supposed to do is to observe in the person. And we know how the person used to behave before they gave birth. We know how what their normal is. And we are looking for any abnormal behavior. As simple as I think the first person who spoke about their experience, they were never caring for themselves that they used to before. Bathing, she used to put on makeup, and after a while she realized she's no longer doing these things. And these are the things we are looking at. We want to tell persons, check their loved one to see if they're sleeping more than usual or they're not eating at all. These are the things we are looking for when we are talking about postpartum depression. So yes, they can, if they have the sheet, very good, they can do it. But if not, just check up on themselves. And I think the first person even noticed that she was not her usual self. And she said she was wondering, is this what motherhood is? Is this what it's supposed to be?
And she couldn't get the joy.
And she could not get the joy. And what we have to recognize too, that sometimes, when we look on Facebook, the new mothers, they make it seem so easy, Sometimes the body just snap back into place, and then they're posting all these videos and, you know, jolly with the baby, twinning with the baby. And then there's this standard there that this young mother, new mother think, okay, that is what I'm supposed to be like. And if they're not like that and they're feeling more tired and drained, then, you know, they think that, okay, I am failing.
And they fall into the depression.
I am failing as a mother, because this view that they have of motherhood, you know, they're not living up to that, okay? And
this is important what you say, you know, Dr. Crawford, because a lot of our people live on Facebook. And Facebook is a lie. I would probably get bashed for that.
Yeah, but
people
they put their best there.
Have all the nice milk and everything on Facebook, and sometimes in reality their life is like, you know, Freddy Krueger, Jason, Friday the 13th. No, so that's why I don't do Facebook, because it's not going to make me depressed. And as human beings, you look at Facebook and you say, oh my God, I'm supposed to be living like this. When you are not living that way, so then you become depressed.
You become depressed.
So we have to be careful with this Facebook and stay off of it if you do not want to get depressed. But I like what you say. The person wasn't their normal self.
Yeah, not their normal
No more lipstick.
Yeah.
And these are little things in the house we can pick up. The husband can pick it up, the sister can pick it up, the mother, the grandmother can say, you know what, Joy used to dress before, Joy used to do this before, but now she's not doing it. And that is what we want. We're going to take a short break, because I see my TV guy behind here telling me to break up. So we're going to take a short break and we'll be right back.
Yeah, man. Another day in the books. Well, hello there. She pretty from head to toe, and are you ready to go? Wait there. Whew. Can't afford to slip up. Not even in my dreams.
Join us on ZIZ TV for Youth Lounge with Skenaipel, a talk show on vital topics such as tourism, entrepreneurship, education, religion, sex education, and mental health, featuring experts from St. Kitts and Nevis and the Caribbean region. Tune in live on the first and third Wednesday of every month at 8:30 p.m. on ZIZ TV.
Good night, and thank you for joining, or welcome back to HealthWise, because I would assume you were looking at it before. This segment of HealthWise I really, really love. This is the personality spotlight. I do believe in highlighting our foot soldiers in the trenches. Too often we are not recognized. The health system does not run on one person. We have a cadre of doctors. And tonight we are going to be looking at Dr. Cleo Smitten-Romani from Nevis. So we are giving Nevis a do tonight. Take it away, Cleo. We're still waiting for the clip from Dr. Romani over on Nevis. Actually, she's the first pediatrician local in Nevis. Dr. Wemani has been home since 2012, it would be, working on the island of Nevis. And she has also lended many support to the pediatrician here on St. Kitts. We're going to take a short break, and then we're going to be right back.
Join us on ZIZ. Join us on ZIZ TV for Youth Lounge with Skenaipel, a talk show on vital topics such as tourism, entrepreneurship, education, religion, sex education, and mental health, featuring experts from St. Kitts and Nevis and the Caribbean region. Tune in live on the first and third Wednesday of every month at 8:30 p.m. on ZIZ TV.
Good night and welcome back to HealthWise. We are speaking about postpartum depression. It is a real condition. Many ladies suffer from postpartum depression after giving birth. This is a time where mothers are usually happy. This is a time where everybody basically welcomes that newborn. All the happiness should be in the home. But some ladies are sad. Some ladies have thoughts that they shouldn't have. And some ladies are ashamed. And because of that shame, they do not access or look for help. Dr. Crawford said that it is an emergency. An emergency means that it has to be treated in the moment. So Dr. Crawford, on island, how can we get help? Dr. Manchester spoke about, preventative measures. You can, do some kind of activity so you don't have to think about this, or you don't have to think about, all the sadness or the overwhelming activities. Speak about, having family members and a good support, social support. On island, who can we contact?
Okay. Well, first, I believe any doctor you go to and you explain to them you're not sleeping, you're not eating, you're having thoughts of harming yourself, or any of the symptoms we would have mentioned, given the history that you recently gave birth or within a year time you've given birth, any doctor would suspect postpartum.
So I like that. Depression. I want you to repeat that. Any doctor. Because sometimes we as doctors, we think, okay, that's not my field. And sometimes I get like that. Oh, no, call Manchester. That has nothing to do with me. But sometimes we are doctors too. And we did psychology. So I love that point.
And even if you say call Dr. Manchester, Dr. Manchester would know what to do. Okay? So every doctor, once you present with any of these symptoms associated with postpartum depression that I mentioned before, and we have been saying over and over again, would suspect postpartum depression.
It don't even have to be a doctor, it can be a midwife.
Or go to the health centers too. And one thing that I found when I was at JNF, at least at the maternity ward, if the mother does not smile with the baby quick enough, they are calling me. They were calling me for an assessment. And it's better to be safe than sorry. Absolutely. So I never used to mind. Even I go and I see, okay, it was postpartum blues, I'm happy. Okay, because we want to be able to catch these disorders very early.
Because it's a continuum, right? You can have blues, and then if it persists past the 2 weeks, now you may be going into depression. And if that gets severe enough, you can start
have
to have
psychotic features.
So
you can have psychotic features. So go to the health center. Once you go to, and we have health centers around the island. Go to any health center, you speak to the nurses. I believe the nurses, they are on very high alert for postpartum issues. Okay. We also have counseling. We have a psychologist now at Joseph and France Hospital, so you can go there. They have outpatient service also, so you can just go and get an appointment or just show up and they will see you.
I like that too. Just show up.
Yeah, you just show up.
People who say, oh, well, I called and the person is on vacation. I call and I cannot get this
an appointment.
Show up.
Just walk in.
Just walk in.
You show up.
That is why we're here tonight. We just want to let you know, if you're having it, show up. Do not stay home and let it, as we say, fester and get bad. Show up.
Yeah, show up. And even if you could go to accident and emergency.
Yep.
And if you go to accident and emergency, you will be directed towards counseling or to the psychiatrist, depending on their assessment. So yes, at JNF you could go to accident and emergency, you could go to the counseling services right beside the eye clinic. That's where the counseling services are. We also have psychiatric services at the Bastia Health Center, and the psychiatrist is there every Thursday at the Bastia Health Center. The psychiatrist is also at the Molyneux Health Center once a month, just in case if you want to go there. You could see the nurse and you could come back again and see the psychiatrist if you so desire. Okay. We also have counseling services. We have the counseling center, and I know they have about maybe 3 counselors now, which is good. And we have private counseling. So somewhat covered. So if you feel like, okay, I don't want to go into the public setting, we have private counseling. So we have, revamped psychological solutions. We have what we call it, Lyamiga, listening and learning. And you could just go on Facebook and search.
So we have Lyamiga, I like that one.
Lyamiga, listening and learning, and the number is 662-5533. And we have revamped psychological solutions, and the number is 662-8699. Now these are what I know and familiar with, but there are some others outside there that you could always just search for counseling in St. Kitts and Nevis, and you would see some options.
So we have help on island.
Yes, we have
and
help.
What we want to let the public know is to be persistent.
Yeah.
One door you didn't get through, go and knock until you get help.
Yes.
Mental health issues, we are pushing it on the dog for too long.
Yes.
And every part of life, there's some mental aspect to it, and it's so surprising that we do not address it. And postpartum depression is one such.
Yeah.
Yes.
So Dr. Manchester, in your practice, have you ever come across anyone?
Absolutely. Most of the times it doesn't get to the severe point. I don't tend to see a lot of the psychosis. That more, one of the biggest risk factors for the psychosis is if you had a history of bipolar disorder, which more than likely you would already be being managed for that already, hopefully. But I see a lot of the blues, and I nip that in the bud right away. I don't remember who gave it to me, but I have a list of all the things. I have them on a list.
Okay, good.
Counseling center is on there, all the private. I have a list. There's a section private and government.
So Doc, you need to share that with our chat.
I will.
You need to share that with our because that is why we are here.
I have a list and I keep it in the drawer under my desk. Every time I hear or I see something, just because I would have been seeing the patient all along, and sometimes they come for the 6-week visit and they just look after me. And I always ask every patient emotionally, how you doing? And sometimes they say they're doing well, but I just know something not right with them. And I would offer them the counseling. Another thing, and I'm glad we're saying get the help to everyone, because I offer the counseling sometimes and they don't want it. And it's probably a lot of shame. It's, the taboo surrounding, I don't want to go to a therapist, I can deal with it on my own and stuff.
It means that, you are crazy, as they like to say.
But what I like to do sometimes, when I have those type of patients who don't want to, I get their family members involved. Let them know. You know, you put a little light.
Yes.
Like, you know, I call up the mom. I have that in my office too. Some patients don't want to go for counseling. And I would say, let me speak to your mom, if it's, you know, somebody and their mom. Or their partner. So I try to bring somebody as in, because the objective is to get help. Solve the problem. And I try my utmost best to go down all avenues to get that problem solved. Okay, can I get my personality spotlight going now? All right. So we're going to as our personality spotlight tonight.
Dr. Cleo Smith-Romani is a pediatrician in St. Kitts and Nevis who responds to the needs of the pediatric population from birth to 18 years. She practices at the Alexandra Hospital and has a private practice at the Smittens Medical Clinic on Nevis. She also extends her services to St. Kitts at Oasis Medical Consultants. Dr. Smith-Romani treats and manages a wide range of symptoms and conditions, including asthma, diabetes, seizures, cold and flu, infections of the skin and stomach. She highly recommends annual well-child checkups and newborn care to encourage a healthy, growing population in the Federation.
Join us on ZIZ TV for Youth Lounge with Sconaipo, a talk show on vital topics such as tourism, entrepreneurship, education, religion, sex education, and mental health, featuring experts from St. Kitts and Nevis and the Caribbean region. Tune in live on the first and third Wednesday of every month at 8:30 p.m. on ZIZ TV.
Good night and welcome back to HealthWise by the St. Kitts Nevis Medical and Dental Association. As part of the show, we normally have Dr. Jensen Morton from the Joseph and Franz Hospital, the director, who normally gives us an update as to what is happening at the Joseph and Franz Hospital.
Good evening, I'm Dr. Jensen Morton.
Okay, so we're gonna get Dr. Morton back, I hope, because he has some important updates to give to the Federation. So we're gonna let you guys sort out the little rough patches and then we're gonna get back. So we're gonna do our wrap up here, and after we would have wrapped up, then we're gonna bring Dr. Morton back in. So Dr. Manchester, I wanna thank you for coming here tonight. We do this is free, we don't get paid. But because we believe that education is an important tool to navigate one's life, to increase your quality, improve your quality of life, to encourage longevity, we come here. We are tired. We all had offices today. I was in theater. I mean, you have theater tomorrow. But we are here because we value you and we want to give you that power. We want to empower you. So that is why we come here tonight. And we just want you to take us seriously, listen to what we are saying. You don't have to capture everything, but just know that something is wrong and seek help. So Dr. Manchester, give your wrap up, and we're gonna have Dr. Crawford after giving her wrap up, and then we would go to Dr. Morton.
Well, in summary, what I want you to take away from our discussion tonight is, one, the risk factors that we spoke about, knowing who you think you need to pay a little bit more attention to, not just us as health professionals, but us as people in terms of our relative friends, colleagues who could be the people that are more at risk for postpartum mood disorders, the blues, which can progress to the depression, the psychosis. So paying attention to those risk factors, the people who have the most difficulty. Also, how we can help to prevent things from escalating and getting more severe. So if we're picking up on the signs, we need to check in with our relatives and friends who are postpartum or even pregnant, because you can have depression in the pregnancy as well. Checking in with them, noticing the cues, and encouraging them to seek help, or you can initiate that contact to get help for them as well. And also, again, to the powers that be, the suggestions we made that can help to alleviate some of those risk factors for our postpartum mothers.
Thank you so much, Dr. Manchester. Dr. Crawford?
Thank you, Dr. Woodley. It's always a pleasure to be here to
and I'll bring you back.
Anything related to mental health. You know, mental health is my passion, and I really like to see how I can assist persons so they could live their best lives ever, to be well. So what I would like to stress on tonight is the importance of identifying what is it you're feeling. Being able to identify when you're not your normal self, when you feel off balance, and to be able to seek for help. I also want to speak to the loved ones and family and relatives of persons who are pregnant and who are giving birth, to look to see if they are okay. Look for some of these signs and symptoms, because sometimes the mother might not be able to recognize it, or they might think it's normal to feel this way. So that's when, you know, the relatives, the spouse, the boyfriend, etc., is important that they will be able to notice these little changes. And I say little changes because we don't want to wait until it is severe. So look for the little changes in their mood, the little changes in the way they're accustomed to carry themselves in terms of grooming themselves, their hygiene. Look for these changes and seek help for them. I outlined several different places you can get help. Once you go there, help would be offered to you. So please don't hesitate, and don't get fed up, and don't get weary of seeking for the help, because help is outside there. If one area might have delayed in a bit, one place might delay in a bit, several other places out there that you can reach out to. The JNF hospital, reach out to any health center around the island. Any doctor that you trust, your own family doctor, or the doctor you usually go to for different issues, you could go to that doctor, and any doctor would have that high suspicion of postpartum depression if there are any of the symptoms that we mentioned, and they would guide you accordingly. You don't have to suffer alone. Help is there. Please reach out.
So I want to thank you guys, and I think we have a postpartum part 3, because somebody just asked me if dads go through postpartum depression as well. So I think that's,
in a sense,
that's part 3. Yes. That's postpartum depression. So I want to thank you, the viewers, as usual, for tuning in. I have my fans. I have people like Silma, who always tune in. I want to thank you so much. All my crew down at Sandy Point, who always send me all the big ups. I want to thank you guys for tuning in. And in reality, we do this show for you.
Dr. Moon.
We do this show for you. So I don't know if we're going to have so it doesn't seem we're going to have that tonight. So however, I want to thank you for tuning in.
Good evening, I'm Dr. Jensen Merchant, the Director of Health Institutions, and this evening I'm proud to announce that the Josephine France General Hospital continues to build on its human resource capacity and has recently had some new additions to its staff. One of the most significant additions that we've made is in the form of our new clinical psychologist, Dr. Dorothy Frances Jefferson. She joins our staff at a crucial time when the Federation of St. Kitts and Nevis has made a pledge to improve the supporting mechanisms in place for persons suffering from mental health disorders and other mental health challenges. So Dr. Frances Jefferson's addition to our staff is absolutely crucial.
Good evening. I am Dr. Dorothy Francis Jefferson, and here at the center, we provide psychological services that seeks to facilitate a variety of services, enhancing patients' and clients' lives. There are a array of services that are involved. We have counseling and psychotherapy services for children and adults. We facilitate psychoeducation. We also have screening for children, and we update the patient's file and maintain their files according to the registry. I must say that I am very enthused to join the staff at the JNF, and I look forward to working with each and every one here. I have been much welcomed, so everything is going wonderfully well.
Good evening.